Well, good afternoon, everybody. Thanks for joining us here for a press conference and update from the city on COVID-19 and our organized response to that as a community. On some calls this week, we heard the federal officials use the sentence, pandemic responses are federally supported, they're state managed, and they're locally executed. And what we want to talk about is the local execution that we're working on here in not only the city of Sioux Falls, but in all of southeast South Dakota here. You know, it's critical that we slow and spread out or flatten the curve of COVID-19. That right now is our number one priority, is how do we slow the growth and flatten the curve, and Jill Franken, the City Department of Health Director, is going to talk about that in a minute. So it's critical to also understand that every single person in this community has a responsibility right now in helping with that, in helping slow that spread. And so collectively, we can make a difference in this. We've talked to some colleagues in cities that are dealing with this much more extensively than we are, and they're hanging on, but barely. And we're in a unique position right now where we can be proactive on the slowing of the spread, so we're taking some measures to hopefully do that. You know, I'm not going to spend a lot of time talking about the stuff you've heard ad nauseum about practicing good hygiene, because we all know that by now. That's critical. We need to continue to press that message. But because of what we've seen, not only in Sioux Falls, but across the state and across the country, and some of the steps that are being taken, we are going to recommend some things to our local health board, who will then make recommendations to our city council, who will hopefully adopt those at a special meeting tonight. And I'll talk about that, why that process is what it is. But today I'm declaring a state of emergency in the city of Sioux Falls. And the state of emergency is declared when the administration needs certain contractual flexibility to do some things that will allow us to expedite responses to an emergency. And so because of that, our Department of Health, our City Health Board is going to be meeting at 6 o'clock, and we're going to be making these recommendations to them. We are going to propose that all gatherings in city-owned facilities are limited for the next 14 days to less than 250 people. So when we look at the schedules and some of the bookings that have occurred and some of the events that we have on the docket, it's going to affect some events in our city for sure. That's places like the Denny Sanford Premier Center or Washington Pavilion, the Orpheum Theater. So gathering in these venues are going to be limited to 250 people for at least the next 14 days, but we'll continue to reassess, and that could be longer as well. The Midco Aquatic Center is going to be closed until March 27 as of right now, and this will all be effective at midnight tonight, so starting tomorrow. Our Parks and Recreation Department and Siouxland Libraries have canceled all their events and programming for the next 14 days, and our community centers will also be closed except for after-school activities until 6 p.m. Monday through Friday. The Washington Pavilion is going to close the Kirby Science Center and the Visual Arts Museum until March 27 as well. Leonardo's Cafe, the box office, and those smaller group gatherings, preschool activities especially, that's especially important at the Washington Pavilion, will continue as scheduled. So the city of Sioux Falls is not taking this lightly. We want to make sure that while we're in this unique position to flatten the curve and stop the spread, we're going to do all we can to do that. And so what will happen tonight is at 6 p.m. our Board of Health will meet, and we will share these recommendations with them. They will then make the ultimate recommendation to our City Council, who we've called an emergency meeting on for tonight at 7 o'clock, and the City Council will have the ability to draft that into ordinance, those recommendations. So we can do that under ordinance based on my ability to declare a disaster, declare an emergency. We can call a special meeting without noticing, so we're using that privilege to enact this process. So you may want to ask, why doesn't the mayor just do this? We got to follow the rules of government to get this done, and that's what we're doing. So those are some of the steps we're taking right now. I will say that this is an extremely fluid situation. I mean, even 36 hours ago, I didn't think we'd be standing up here doing this, but even as the news cycle has evolved over the last 24 hours, people are taking this seriously, and I think that's really good. A lot of the events that we're looking at postponing and canceling, let's just be honest, they're not life or death events. We're talking about basketball games. We're talking about hunting expos. We're talking about things that aren't going to change anyone's life dramatically if we exercise an abundance of caution. And so we are proceeding with the exercising abundance of caution. We're not in panic mode, but we're cautious. And that's what I think people want to know is we're being cautious right now, but we're not in panic mode. And so your city's in a good spot. We're working closely with, obviously, with the State Department of Health on this response, as well as the feds at the national level. So with that, I'm going to turn it over to Jill Franken. Jill's the city's health director, and she's going to share some additional updates on our COVID-19 response.
So the health department, in partnership with the State Department of Health and our healthcare partners, has been preparing to respond to COVID-19 since January. And as it's been announced by the State Department of Health, we know we have cases of disease in our community, 3 cases total as of today in Minnehaha County. As a public health director, today I made the recommendation of the mayor to limit large gatherings in order to limit the spread of disease in the community. We do not want the red growth curve to occur. We do not want that to occur. We want to be able to take and spread out the number of cases that we will have and have them be at a much lower level of curve and flatten that curve so that we can give more space for our hospitals, our emergency responders, and others to be able to manage the people that are going to be diagnosed with coronavirus. And so it's going to be really important for us to do these measures. In addition, as we continue to flatten that curve, we can hopefully continue to mitigate the spread and continue to reduce the risk to those vulnerable populations, those high-risk populations in our community. So that's really what we're attempting to do today with this emergency declaration. You all know that each of us, this is a community effort. This is a community problem, and we as a community can resolve to make a difference and make sure that we are having an impact against this virus. So we all have to practice extremely good respiratory hygiene. I know the mayor said that you know that, but I wouldn't be standing up here doing my job if I didn't remind everyone. Make sure you're doing your good respiratory hygiene. You're washing your hands a lot. You're using hand sanitizer if you don't have access to a sink. You're taking those precautions to stay home if you're ill, and if needed, contact your healthcare provider, call your healthcare provider and seek advice. And make sure that if you're in those high-risk populations, you have extenuating health circumstances, you're elderly, please be staying home from the public and staying away from the public as much as possible. Again, like I said, now is the time for us to really continue to step up our actions as a community. And one of the things that we are going to do additionally as the City of Sioux Falls is we are also building out our Emergency Operations Center. We've had a planning group that's been meeting for some time here, and now we're going to actually, as of tomorrow morning, open up our Emergency Operations Center, and it'll be a multi-agency team. We'll be partnering with our health systems to make sure that we can continue to work together to manage through this time period and make sure that we're making really good decisions for the community. So, you know, I don't know if lucky is the right word to use, but we're somewhat fortunate because we've seen what's been happening in other states in the country, and we've been actually, seeing what's happened across the globe. And so we have there's lessons learned, there's best practices already starting to emerge. Just recently we got some new guidance around mitigation strategies for communities, which has helped inform us today in making the decisions that we are. And so we are going to be able to make a difference. That's what we do in Sioux Falls. That's who we are. We can do this, and I have no doubt we can make a positive impact for our community. Thank you.
I just want one last point of clarification before we open it up to questions. A limit on events and saying we're trying to put a cap on events of 250 people. Those are at city-owned facilities. I can't dictate if a church wants to have church or if other private gatherings want to occur. What we can say is that's the role we're taking, and we'd encourage our community partners to follow suit because we think it's a best practice. It's a CDC recommended best practice. So I would encourage those who have events coming up like that aren't in city-owned facilities just to think twice about them, as we have. There's some tough decisions we've had to make because of this. There's some disappointed people because of this, but it's the right move based on what Jill just mentioned in terms of a very proactive plan of response. So